Hi guys, welcome to my Plastic Surgery Minute. Today I'd like to speak with you about the arms and in particular the aesthetic surgery of the arms. How do we enhance, beautify, rejuvenate the arms nowadays? First of all, let's say that the arms play a very important role in the overall body shape, whether it is in female, where thin arms are a sign of femininity, or in male, where strong arms are a sign of masculinity. What about the anatomy of the arms? First of all, there is a deep bone, the humerus, and then soft tissue around, mainly three: the skin, the fat, and the muscle. And these three soft tissue can play a role in the shape of the arms, and also we, as a surgeon, we can play on these three elements. What about the beauty standards of the arms? First of all, we need to do a clear difference between female and male. In men, this is quite simple. All men want more or less the same type of arms: athletic, muscular, strong, where the muscle, deltoid, biceps, triceps will show clearly. In female, this is quite different. Not all women want the same arms. Some of them don't want any definition, just smooth contour. Others want light definition with just little bit muscle show, and other one want high definition like men, where clearly all the muscle will be very visible. Of course, the arm is not only about aesthetic, it's also and mainly about function, because the arms is a very dynamic area that we need to appreciate in 360 position: front, side, and also back. Also different position of the arms up, arms down, and different contraction of the muscle. Now, what are the main requests for the arms from our patient? Basically, it can be either an excess of tissue or volume, or on the other hand, a lack of tissue or volume. Let's start by the excess. It can be an excess of skin laxity, an excess of fat, chubby arms, or both skin and fat excess. And it's mainly in female that want a smaller, thinner arm. On the other hand, it can be a lack of tissue or volume, where basically the muscles are too thin, and it's of course mainly in men that want stronger, bigger arms. So how do we address this different problem? Skin, fat, and muscle. Regarding the skin, we have different options. It can be the classical arm lift, brachioplasty, with a long scar, longitudinal scar from the elbow to the armpit, which is very efficient, but leaves a visible scar, which is not always very accepted by the patient. We can have also a variant of the arm lift with just a transversal scar in the armpit, which is called the axillary armpit. And sometimes we don't need to cut the skin. We can just tighten the skin with a new skin tightening device, such as G-Plasma or BodyTite. Regarding the fat, this is obviously the indication of a liposuction. And regarding the muscle, the indication of the contrary, lipofilling or fat grafting. It means the injection of fat within the muscle, deltoid, biceps, or triceps. So of course, in a same patient, very often we combine the technique. For example, when it comes to reduce the arms, we start first of all with a liposuction. Then the next step will be to do liposuction plus a skin tightening device such as G-Plasma. Then the next step will be liposuction plus arm lift in the armpit. And the final step will be liposuction plus arm lift with a longitudinal scar. On the other hand, when it comes to increase the volume of the arms, we combine also very often two techniques. In some area, we are going to do some high definition liposuction to really sculpt, define the contour of the muscle, and then lipofilling, again, to increase the muscle themselves, again, deltoid, biceps, and triceps. And I like also to address the role of the arms in the proportion of the body with two ratios. One mainly in female and one mainly in male. Number one, in female, there is what we call the bar, the breast-arm ratio. This is something that I personally describe. And when you are on the side, when a female is on the side, this is actually the ratio between the width of the arms and the projection of the breast. Basically, women, they want thinner arms and bigger breasts. On the other hand, in male, mainly we have the Adonis ratio, the shoulder-waist ratio. Adonis was a Greek god with a beautiful V-shaped body coming from wide shoulder and narrow waist. Definitely in male, we want the same. We want this V-shape, and how we do that? We increase the shoulder and we snatch the waist. So as a conclusion, you have seen that there are different problems for the arms and different surgical technique to address this problem and to fix them, whether it is for male or female. But what is sure, the arms play a very important role, aesthetic role in the overall body shape, and they should not be forgotten. Thank you for your attention and see you very soon for the next episode.